So good day, my curious lovers. I hope that you really enjoy this presentation. I am the author and the presenter, Naja Thomas. My topic is empowering kidney health with advanced machine learning for chronic kidney disease risk assessment. I will leverage predictive analytics for early detection and then overall improve patient outcomes. So this whole entire presentation is based off of my own personal journey to explore challenges that utilize CKD data across various data structures while also enhancing the interaction between patient and providers. Let's get started. I hope that you love this presentation, my curious lovers, and let's go. So the introduction to CKD, CKD is a progressive loss of kidney function over time. In its early stages, it is unknown to actually be diagnosed with CKD, and which leads to more late diagnosis. So, from a global perspective, there are rising prevalences worldwide, and early detection can really slow the progression and reduce complications. There are some key risk factors, includes diabetes, hypertension, age, and genetic predispositions. So for the research objectives, first, I developed the machine learning models for CKD, risk assessment and stage classification. Then I looked at identified those key clinical indicators. I looked at blood glucose, blood pressure for early detection. Three, I also addressed those class imbalancement because of the data structures were different. When I had to combine them, it caused a lot of different problems as I was creating my models. And so last is the interpretation tools for healthcare providers and patients. So my data set overview, the source I used was UCI's Machine Learning Repository. It was a combination of two different data structures. It was a total of 600 patients. It was 43 clinical indicators. It included demographics, lab results, and comorbidities. The target initially was a multi-class. I wanted to look at the CKD stages. And then later, because of how I do my research and how I love to do explore, I'm an explorer type of person. I later had to fall on binary, which was whether or not the patient has CKD and non-CKD. And so for my pre-processing processes, I handled missing values. I used mean and median imputations. I encoded categorical variables. I used label encoder. And then I split my data 70% training, 30% testing. So for my key findings or my data analysts, for figure one, for class distributions, there were about 350 cases. The patients had CKD and 200 where there were non-CKD cases. It was a stratified sample to ensure that there was a fair model training. So for the correlation heat map, there were strong correlations. I want to say blood glucose and diabetes, of course, at 0.64, serum creatine and blood urea at 0.59, and hypertension and diabetes at 0.61, where the blood glucose distribution, it shows that CKD patients have a higher median blood glucose level between approximately 550 and 500 mgdls versus 80 to 150 mgdls for non-CKD patients. So for the machine learning models, there were three top performers: AdaBoost, XGBoost, and LightGBM. All of them were greater than 95%. There were no false negatives in AdaBoost. There was a faster predictions in XGBoost, and for LightGBM, it was faster training and it's ideal for real-time use. So if we look at the confusion matrix, we can see that the best model out of all of these top three performers would be AdaBoost. And so to interpret the true positives from a healthcare or a clinical perspective, we can say that the model correctly identified 89 patients who actually have chronic kidney disease, which shows that this specific classifier is effective in detecting actual cases of CKD, which is crucial for timely intervention as well as treatment. So for our false positives, the model incorrectly identifies 6 patients as having CKD when they really don't actually have CKD. While this is a relatively small number, it does lead to unnecessary anxiety or treatment for these patients. And so it does emphasize that it's important to have that balance between specificity and sensitivity in any model. So again, our false negatives were at 0, which means the model did not miss any actual cases of CKD. And this shows a significant strength where missing a diagnosis of CKD could potentially lead to severe health consequences for patients, which includes progression to also end stage retinal disease, right? So let's move on to the next slide. So let's address some of those class imbalance challenges that I had. Because my data set was unevenly distributed between CKD as well as non-CDK cases, I had to use different solutions. First, I used stratified sampling to maintain my class proportions. And then I used ensemble models, AdaBoost model, XGBoost model, because it focuses on misclassified cases, right? And so the result is balanced performance across all classes. So for the clinical application, for early detection, it identifies high-risk patients before symptoms appears. For our risk stratification, it predicts disease progression between stages 1 and 5. And then for a more personalized treatment, it really would recommend interventions based on those key indicators like blood pressure control is one of them. And so, in conclusion, in future work, some key takeaways is that machine learning models, the ones that were used at top performers, AdaBoost, XGBoost, LightGBM, all achieve greater than 96% accuracy. In CKD prediction, we have blood glucose, blood pressure, and serum creatine are critical indicators, and that my model provide transparent and actionable insights for clinicians. For my future directions, I would hope to expand my data set to a more broader generalizability, as well as integrate my models into the EHR for real-time alerts. These are my references for anyone if you are interested. I hope that all of my curious lovers really enjoyed this presentation. It was a combination of, I want to say, of biomedical data science combined with just the hard foundation of data science. And so it took you on my journey of challenges of using unstructured data, of trying to combine that data set and trying to provide you with more of a health outcomes to better align to patient and provider interaction. How can we catch the early stages of chronic kidney disease? How can we better utilize data science and metrics to give to patients and providers to better understand how to tackle these different challenges, right? So please like, subscribe, and add. And I hope that you enjoyed this presentation. Have a great day. Talk to you soon.